Let's talk about root canal.
Okay.
I've heard that people have, I thought for a long time, when you do a root canal, the root comes out. But I heard that that's not really the truth. What's happening in a root canal, and why, after a root canal, for instance, why do we need a cap or a crown on it, when yet some of us, including have one for, 12 years now, 15 years now, no cap, no broken. Right. Shed some light on it.
Okay. Well, that's one of the most frequently things that patients ask me. They said, well, if I had a root canal, there's no root left in the tooth, is there? And I always have to explain, no. The root canal basically is the removal of the nerve tissue that is in the center of the root itself. And now the nerve tissue, as we all know, maybe we don't all know, but it's a nerve as well as a blood supply as well as a lymphatic organ. So it has a threefold purpose. Once that's removed and the inside of the root is filled with an inert material, the reason that most of us dentists usually suggest having a crown put on the tooth is that most of these root canal teeth have either large restorations in them, fillings in them, or they've broken, and that's what's caused the nerve to die and why it needed a root canal in the first place. So a crown is a good restoration to protect the tooth. The second reason is that these teeth become very brittle. They don't have their natural hydration supply of the nerve, which was in the tooth before, so they can become brittle, and they are very prone to breakage. Now, you have a tooth that has never needed a crown and had a root canal. It depends very much on where that tooth is positioned in your mouth. There are teeth that don't really bear a lot of stress during chewing or biting, and they can last for quite a long time, in fact indefinitely, without a crown on them. However, if you have teeth that are subject to a lot of function, like our molars and our premolars, you really need a crown to protect it from the forces of occlusion. So that's why we generally recommend a crown.
I see. So basically the tooth becomes brittle because the oxygen or the blood, the whole flow, the tooth doesn't get nourished the way it used to be nourished because the nerves are gone, which transport the nerve. So it gets A, brittle, and B, in order to do that root canal, to drill that hole, you probably made that whole tooth a little weaker. So it's kind of becoming, instead of like a big full stick, it becomes a pipe, kind of. Right. And so that's why you do it. But sometimes it's not. Sometimes it's okay to because you're not pressuring it so hard. So that's why it maybe survives.
Right.
Okay. All right. Well, let me tell you. Let me ask you something. Does a root canal? Does a hurting tooth? Patient has a toothache. Does that usually mean root canal? Because that seems to be a perception out there. Does that usually mean root canal?
Not necessarily. Our teeth can hurt for a variety of reasons. And generally, the pain that we're feeling from our tooth comes from the irritation of the nerve within the tooth. So sometimes you can have a cavity and that can make the tooth hurt, but that doesn't mean you need a root canal. Once the diseased portion of the tooth is removed and that part of the tooth is restored with the material, the pain usually goes away. And then we have other situations. As we get older, we get a little gum recession, so our roots are more exposed and they can become sensitive. That doesn't necessarily mean you need to have a root canal. Root canals are generally done on teeth when there is irreversible pulp damage. The pulp is, of course, the nerve of the tooth. When that becomes irreversible and it becomes infected, then a root canal is absolutely necessary.
Now, one last question.
Sure.
We usually keep referring to, I'd rather have a root canal. And we refer that to something really bad, such as paying the taxes or something,
Right.
There's something really bad and we say, oh my God, that's bad. I'd rather have a root canal, meaning, a root canal is one of the last thing we want. And yet, when I had my last root canal, which was, I think it was about a decade or so ago well, frankly, it was a little bit unpleasant to keep your mouth open for a good half an hour. But rather than that, I don't think there was any discomfort.
Yes, I can tell you from my own personal experience of having root canal myself and of the patients I've treated and my friends who are specialists that do root canals, in general, and I mean into the 90% range, they are not uncomfortable. It's a common myth that has come about from years and years ago when root canals were done in the 20s and 30s and were extremely uncomfortable. Those days are gone. The endodontists and the general dentists now doing root canals are very, very comfortable. Patients have very little to fear from that.
Yeah, because I mean, you obviously the injections are very good, and you guys these days, you have those beautiful, long, very thin needles, and you on top of it numb the whole thing before you even stick that needle in it. So it just is relatively pleasant.
That's correct. Yeah.
Though,
Sure.
Apparently, some teeth have more than one or more than two roots, and which is one of the reasons why it is difficult for dentists to even give a quote on a particular root canal, because they don't know how many roots that tooth has. Is there any truth to that?
Yes. Research over the past 30 years has shown that teeth that we used to traditionally think only had three roots, such as the upper molar, first molar, can have 4 and even 5 root canals. This is why you'll see many, many endodontists now. In fact, I would say well over 90% of the endodontists are using actually microscopes to look inside the tooth while they're working on it to locate those accessory canals. Because if you have a molar that has 4 canals and you only treat 3, that's a recipe for disaster. That tooth will eventually fail. And there are other teeth that we have in our mouth. For instance, the premolars or the bicuspids, the smaller teeth that are next to the root canals, traditionally have 1 or 2 root canals, but sometimes can have up to 3 or 4. So that's why the endodontists now are relying on microscopes to really look inside the tooth to see how many canals there are.
Makes sense. Looks to me like digging out a tree. I mean, I'm somewhat a farm boy, and you have this little tiny tree, and Dad and me will go, okay, let's cut it, let's stick it out, and that son of a gun doesn't come out. Why? Because there are 2-3 more roots. And they're going all over the place, and it's much more complicated than you thought.
Exactly.
Okay. Dr. Pakman, as always, very informative. Thanks a lot.
You're welcome. Thank you.